My name is Flynn Rowan. I'm an orthopedic surgeon with a subspecialty training in spine surgery. In my 5th year of practice with Indiana University as an assistant professor. Here talking about a patient of mine who initially presented last year with ongoing neck pain for several years, along with pain radiating from the neck into the shoulders and down both arms. This patient's pain and symptoms had been going on for years and getting worse. She'd already tried multiple treatments, including medications, physical therapy, and given enough time to sort of improve on her own. When we talked to her, we talked about continuing any of those therapies or even proceeding with more interventional things like injections as a more definitive procedure to try and once and for all alleviate or improve her pain. When planning out surgery for this patient, I took into account many factors, one of which is the need for different devices for different levels of her spine. In a case like this where we're planning a hybrid corpectomy at one level and a discectomy infusion at another level, to me it's important to have a single manufacturer that can supply devices that will adequately take care of both levels. When preparing for a surgery like this, we take into account both features on X-ray as well as MRI. On X-ray, she has arthritis at multiple levels with disc degeneration, bone spur formation, and those bone spurs are pushing back into the spinal canal, not only at the level of the disc, but particularly behind the C5 vertebral body. There's significant stenosis seen on MRI, both in the sagittal and axial views. And to me, a discectomy alone is not enough. In a patient like this, we really want to adequately decompress the spinal cord, and that involves a full corpectomy at that level. Part of the reason for choosing this particular implant is the Matrixx Corpectomy system. Like with all of Nexxt Spine's implants, they use a porous structure throughout the 3D printed cage, incorporates multiple pore sizes, which naturally mimics bone, promotes ingrowth, and gets a really solid fit and helps promote a fusion. This patient's surgery was just over 6 months ago. She had almost immediate improvement in pain in the neck and almost near complete improvement in pain radiating down into the arms. Over time, that's continued to improve to the point where she has minimal pain at this point, is very functional, and is incredibly happy with her outcome. I've used a number of types of implants previously, both for corpectomy or discectomy applications, including PEEK, allograft bone, or other titanium cages. I think the Nexxt implant variety is superior for multiple reasons. I don't think PEEK provides a great substrate for fusion. Bone is notoriously hard to size and can fragment over time, and some of the other discectomy options in titanium just look like a chunk of titanium. They don't have the same pore sizes that allows ingrowth. And the other nice thing about the Matrixx suite of implants is they have a product for pretty much every application, every size, lordosis options you could need, which really makes it easy for the surgeon. For this particular patient, the benefits are clear. She's not even 6 months out from surgery, and X-rays show a very stable, rigid construct. She's had a great outcome clinically, and I think that's testament to the implants we chose for this patient. I think anterior cervical decompression is a wonderful procedure. Taking pressure off the spinal cord, taking pressure off the nerves, creates a dramatic improvement in the patient's quality of life. The key to that, though, is not only adequate decompression, but also a successful fusion. And that's where the Matrixx components come into play. So the reason I initially chose to use Nexxt Spine was the standalone cage. It offered something that just wasn't on the market anywhere else, and it came in sizes that other manufacturers just couldn't supply. Once I used that, I realized they had a solution for everything in the cervical spine: corpectomy, partial corpectomy, standalone options, and just the run-of-the-mill ACDF. Not only that, they have a very thin, solid plate. And so for patients where I'm worried about dysphagia, I can either use a thin plate, a standalone option, to really minimize those complications, particularly in older patients.